Hi everyone, welcome back. So if you've seen, any of my other videos, in quite a few of them, I refer to how massage can help with chronic pain. So that's what I'm going to be talking about today. Chronic pain is any pain that continues past 6 months, whether it be due to illness or injury. And it can be linked to other symptoms, maybe stress or insomnia, which then, can turn it into chronic pain syndrome, which is where it basically becomes a pain cycle, which I'm going to talk about today. Acute pain is a normal response of the nervous system to warn you of potential injury. But with chronic pain, the nervous system repeatedly sends these signals, and it can carry on for months, even years in some people. And this may be due to an initial injury or infection, or maybe an ongoing medical condition, but the pain continues past the injury recovery period. And so what happens when you get this chronic pain cycle is it can affect you both physically and psychologically. So the physical effects of being in this chronic pain cycle is that, you'll have an injury or illness, whatever it may be. And, it will cause you some pain, which, then you're going to get tightness in the muscles, which you would with any injury, leads to reduced circulation, maybe, not enough oxygen and nutrients coming into the tissues. You get muscle inflammation as part of that healing process and reduced movement. But with chronic pain, as we've said, the nervous system repeatedly sends these messages. And so each stage of this cycle leads on to the next. And so there's never a point at which, say, the pain gets resolved, and so then you don't get that muscle tension and you don't get the reduced circulation that comes with tight muscles, which means that you don't get that inflammation and the reduced movement. And so hopefully in this video I'm going to show how through massage you can basically break this cycle by addressing just one of these areas. It then stops the cycle because it won't then lead on to the next thing. Now, there are numerous, chronic pain conditions. So, I'm not going to list all of them, but certainly some of the sort of common examples are things like arthritis, chronic fatigue syndrome, chronic low back pain, chronic migraines, chronic myofascial pain syndrome, coccydynia, which often occurs, if you've had a break to that coccyx at the bottom of the spine, diabetic neuropathy, endometriosis, which of course I've done a video on, fibromyalgia, which I've done a video on, inflammatory bowel disease, interstitial cystitis, temporomandibular joint dysfunction, which affects the jaw, vulvodynia, so many different issues, many of which, as I say, I've not sort of mentioned. Now, with the chronic pain cycle, what happens is that when the brain identifies a stressor, we know that it then initiates the fight or flight response, which results in physical effects in the body. And again, if you've seen my video on, on sort of the physical effects of massage, you'll hear me talk about how massage reduces, inhibits release of those stress hormones like your cortisol and your norepinephrine, which are those hormones that initiate this flight or fight response. Now, so when this fight or flight response is initiated, the central nervous system then continues to initiate this state, which is where you then get repeating of this pain cycle. And, you know, as this cycle and this fight or flight response keeps getting initiated, it causes the pain to then become chronic. Because as I say, you don't get, unless you can sort of actually find a break in that cycle, it's just going to go on to the next thing and the next and the next. And both, obviously, the physical factors that we've just talked about, and also psychological factors contribute to rewiring the brain and perpetuating, you know, these painful sensations. So when I talk about psychological factors, I'm talking about when, you will get maybe some anxiety. It will start with some anxiety due to various things. So it could be, the fact that you already have compromised function or general health concerns. Maybe you already have a medical condition. You might have time-consuming hospital visits or side effects from medication. These, among other things, can cause career disturbances. Maybe you have to give up your job. And then that can lead on to having financial concerns, which, in turn, you may end up with depression and fatigue. Possibly, this will lead you to feel angry and frustrated. It can bring on, sexual performance anxiety. Which then, you end up with relationship and family worries. So all of these things in our everyday life that may just start by giving us a little bit of anxiety, or maybe we'll have a bit of trouble sleeping, because we're worried about something. But when these issues don't get dealt with, what happens is that we find ourselves sleeping less, which then means we're less able to cope the next day. And so our anxiety builds, and this fight or flight response keeps getting initiated. And so then we start to suffer pain, which every time that fight or flight response is initiated, the pain seems to get worse and lasts longer. And so then in turn, we find it harder to cope with all these factors that I've just mentioned. And we start to feel that the situation is a bit hopeless, which then perpetuates this cycle of not sleeping, because there's increased worry, increased anxiety, which then increases the pain. And so again, we go round and round in this cycle. And so these psychological stressors can manifest in the body as physical symptoms, such as pain, muscle tension, which can then cause further physical issues, which worsen those initial psychological factors, hence the chronic pain cycle. So let's just summarise on the information that I've given you so far. So we start with these psychological stresses, things in our everyday life, So it could be past injuries or accidents, health conditions, maybe an issue in our relationships or our family, work, anxiety, sadness and grief, anger, maybe some kind of childhood adversity or unresolved painful memories, sometimes PTSD, social isolation or rejection, discrimination, and many more. And these can also then tell the brain, blood flow shifts from the frontal lobes of the brain, which are under our conscious thinking, into the limbic system, which is our emotional and our reactions, our fight or flight response part of the brain. And so the brain tells the body to release those stress hormones, and we go into that fight or flight response. And when that happens, the autonomic nervous system can cause acute spasms and other physiological changes anywhere in the body. Emotional factors will, light up certain areas in the brain. And when they are activated, the area of the brain that helps to decrease the pain, which is the dorsolateral prefrontal cortex, that turns off. And so we start to get this chronic pain. And so the muscles are affected, blood flow is affected where those muscles are tight, the nervous system, the heart, gastrointestinal system, and the genitourinary system are all affected. And you can feel pain pretty much anywhere in the body, tingling, numbness, burning, IBS and bladder symptoms, palpitations, rapid heart rate, headaches, migraines. And the nervous system can learn to feel these sensations. As the cycle repeats, the brain and central nervous system can become wired to make the body feel continuous pain. Often, times even in the absence of structural or tissue damage, we can still end up feeling this pain. And so the pain and the learning by the nervous system then returns as further stress. And this is stresses from pain. So the sensitized nervous system, fear, worry, anticipation of pain, associating the pain with some catastrophic health issue. And these stresses that are caused by the pain then combine with those initial psychological stresses, and the cycle repeats itself once again. Okay, so I'm now going to talk about the pain spasm cycle. Now, while treating pain and muscle tension would seem, the obvious way to break this pain cycle, the PPS model suggests that the pain cycle is more likely to be broken by addressing the healed outcome of injury, i.e. scar tissue. And I've done a video also on scar tissue, so if you think this is applicable, then it might be worth watching that video. Now, the two cycles within the PPS model are the paired, primary and compensating scar tissue areas, and secondly, the energy depletion cycle that results from that first cycle. And they increase fatigue, muscle weakness, reduce circulation, which all perpetuate the cycle and can be responsible for inflammation that doesn't respond easily to treatment. Now, if pain and inflammation result from the scar tissue cycle, then treating the effect, i.e. the pain and the inflammation, will only feed the energy depletion cycle. You have to treat the cause, i.e. the scar tissue. Now, if a massage therapist works directly on areas of pain, it can exacerbate the inflammation and cause further fatigue, so you actually achieve the opposite of the intention. Now, for many clients, this may help. For a chronic pain client, they won't have the energy to deal with further inflammation, and so the cycle continues. It's very difficult for the body to heal while dealing with pain, and if the muscle continues to stretch due to overuse while compensating for scar tissue, the body will not heal. With heat and stretching, scar tissue can adapt and the muscles can start to heal. And again, I'd recommend you watch my video on scar tissue, which will tell you more about this. Trigger points, which I will also do a video on in the future, can be found between two areas of scar tissue. And by working these areas, it's then possible to decrease the trigger point pain without increasing the inflammation. Then the body has, the energy to heal because the inflammatory response is not necessary to fight the pain. So trigger point therapy can really be very beneficial for chronic pain clients. Now, I'm going to talk a little bit about the pain gate theory and pain management. So our perception of pain is influenced by emotions just as much as being influenced by pain intensity. Pain signals have to navigate their way through the peripheral nerves and gates or inhibitory neurons in the spinal cord before being transmitted to the brain and perceived as pain. Now, clearance through these gates depends on pain signal intensity, the intensity of other sensory signals from the injury site, and also messages from the brain. Pain signals will only be perceived by the brain as pain if they are more intense than other sensory signals from that injury site, hence opening the pain gate. Transmission of pain signals can also be affected by emotions, which is why chronic pain clients may not feel so much pain when doing certain activities. But if they're suffering from depression, as is common in chronic pain clients, they may struggle to cope with the pain. And such emotions can increase or decrease the messages sent by the brain, which impacts on pain signals crossing the pain gate. Now, with this in mind, how does massage help to relieve chronic pain? Well, massage reduces pain by stimulating the release of serotonin, which is one of those endorphins, which, as well as enhancing the mood, is an anti-pain chemical. So by releasing this, massage helps work on the emotional factor and also on the pain factor. Also, it offers stress relief by working on the nervous system and inhibiting release of those stress hormones, the cortisol and the norepinephrine, which cause anxiety and initiate that fight or flight response that can be the start of the pain cycle. It also promotes deep sleep, which then alters our perception of pain and our levels of anxiety. It improves range of motion by increasing the circulation and working on those trigger points to reduce the inflammation and, those problems that are associated with scar tissue. It also improves quality of life by enhancing mood through that endorphin release, the serotonin, the dopamine, and the oxytocin release, which impacts on transmission of pain signals and allows a client to manage their pain more effectively. Oxytocin, as we know, also has muscle relaxant properties. And as some of you will know, oxytocin is, one of those hormones that kicks in, when you go into labour. And it also helps not only with the bonding process, but also the relaxing of those, muscles down below to, allow for the labour process to take place. Massage can also temporarily alter the body's perception of pain. Now, if you are a chronic pain patient and you are considering having massage to help manage your pain, the advice I would give you is, certainly talk or see a therapist who is registered and qualified and experienced in dealing with chronic pain issues. Talk to the therapist about your chronic pain and ensure that the treatment helps to relieve the symptoms rather than aggravate them. Make sure that they are going to work on the cause rather than the effect, and that it's not going to cause more inflammation in the body. And I'd also say, make sure that you see the same therapist. If you're going to be having a course of treatment, which would be indicated in a chronic pain client, see the same therapist each time so that they will build up a picture of you and how your chronic pain affects you. And that in that way, the treatment will become more efficient as it goes on. The massage should be suited to your condition and account for possible flare-ups. So, for example, in something like fibromyalgia, certain types of massage won't be appropriate because they'll just cause a flare-up and then put you into more pain and fatigue, etc. And if something is painful during the massage, tell the therapist, okay, because they can adapt the techniques and, figure out what works for you. And also, use other therapies alongside massage that involve movement. Many people think that, people with chronic pain, you should avoid physical activity because it will worsen the pain. But actually, it causes those muscles to weaken, which can then further the pain. So it's really important to, alongside massage, do things like stretching or light exercise, just keep moving. And, that will also help release those endorphins just by doing exercise, which again is going to improve the anxiety levels and the mood and, that sort of psychological stress factor. So, so hopefully this has given you a little bit more of an understanding of how we perceive pain, how your body gets into that chronic pain cycle, and also given you an idea of maybe some things you can do to try and break the cycle, or certainly stop it from, getting any worse. As always, feel free to comment down below, or you can message me with any questions through my Facebook or Instagram page. I believe links are down below. Do subscribe to my channel and you'll be informed when other videos come out. But as I say, it may also be worthwhile you watching the video on scar tissue in the body. This is not only just external scar tissue, but it covers internal scar tissue that can be a real factor in that pain spasm cycle that we've just talked about. But for now, that is really all from me. So take care of yourselves and I will see you next time. Bye.